I spoke to Assistant Secretary of Health at Department of Health and Human Services, Brian Christine, at the Museum of the Bible, where there's a meeting going on of the Religious Liberty Commission. Here's the advice that he gave to medical students who are required to perform transgender procedures for minors or abortions, which violate their freedom of conscience. We are at the meeting of the Religious Liberty Commission where you just spoke. Why is this issue important to you at HHS?
Well, I will tell you, I am old enough to have voted for Ronald Reagan, and this administration is the most pro-religion and pro-religious administration that I think I've seen in my lifetime. And at the Department of Health and Human Services, obviously under President Trump's leadership and guided by Secretary Kennedy, we are taking these things seriously, and we are working to make sure, for instance, that the Hyde Amendment is protected, that no federal dollars go to abortion services. We are working hard to make sure that conscience protections for physicians, nurses, healthcare professionals, healthcare institutions are protected. So we take this really seriously, and today's commission falls right in line with that ethos.
One area where religious convictions have come up for doctors is in performing transgender procedures in general, and particularly for children. How are you making sure that people who have a religious conviction against that are not being required to do those types of things?
Again, conscience protections are incredibly important, and so we are ensuring that, again, doctors, nurses, pharmacists, individuals whose faith demands that they do not partake in these sex-rejecting procedures on minors, they're protected from retaliation and harm.
You recently had a video talking about how no one's religious beliefs should cause them to lose custody of their children in cases where someone has a child who identifies with a different gender, and there's been cases where those children have been separated from their families. You said that states will not be allowed to do this kind of thing. What are you doing to make sure that this doesn't happen in the states?
Yeah, we are absolutely protecting a parent's right to keep their children under their care. Again, if you have a set of parents and their child has gender dysphoria and there are threats to remove that child from your care, that's absolutely wrong. This administration, Secretary Kennedy, we stand firmly against that.
This is something that's happened in foster care situations as well. What can you say about what you're doing to make sure that even foster parents don't lose custody of children over that type of issue?
No, again, we are absolutely making sure that those parents, foster parents, parents who feel that their children should not be subjected to sex-rejecting procedures, that they can't be coerced or they can't be threatened into going against what they deeply hold is best for their child.
You sent letters to states holding them to this standard that you've been describing. What will happen if these states don't comply?
Again, what we feel is that these states absolutely need to protect and need to respect the parent's stance. That's what's so important to us. We want to respect the parents' rights to decide what's best for their children and to make sure that children with gender dysphoria are treated the right way. Our report on gender dysphoria in minors showed clearly that the science, quote, supporting sex-rejecting procedures is very thin. It's not substantial, and the best way to treat these children is not with castrating chemicals or mutilating surgeries. It is with competent and compassionate mental health care, and we're making sure that parents who decide to go that route with their child aren't going to be intimidated.
Some states have laws which make it difficult to find that type of mental care which affirms the child's biological sex. Is there anything that you're doing to make sure that parents are able to find that kind of therapy if that's what they're looking for?
Yeah, as opposed to the Biden administration, which was offering, and my predecessor, which only offered parents, again, chemicals and surgeries. We're offering hope. We're offering truth. On our report, we're offering the truth that mental health care is best for these kids. We're going to stand with them. We're going to stand beside them. We're going to help the parents take care of and love these children.
What are some areas in the past where you feel like religious liberties have not been protected by HHS in a way that you're doing differently?
Well, I think absolutely. If you look back through the pandemic when, again, people like myself, physicians, nurses, therapists, medical professionals were threatened with loss of licensure, for instance, if they didn't comply. So again, we believe that protecting a person's deeply held religious convictions and conscience is important. Again, we're going to make sure that these individuals don't have to bend the knee to some harsh and ambiguous government.
How does your faith influence your role at HHS?
It's the compass that guides me. I am a Catholic, and absolutely, I take this role seriously. I take the role to serve the Republic and serve President Trump seriously, and my Catholic faith, again, is a compass that guides me into doing what's right for our Republic and serving the President that way.
Another area besides these transgender procedures where doctors might have a conscience issue come up with procedures would be with abortion. Could you describe what you're doing particularly to protect doctors from having to prescribe the abortion pill or perform abortions if that goes against their religious views?
Yeah, as I said in my speech today, that President Trump has been very clear that we are enforcing the Hyde Amendment, ensuring at HHS, ensuring that no federal dollars are going toward abortion or abortion services. So we are enforcing the Hyde Amendment. That's incredibly important for this. And again, conscience protections. There were several Biden documents that we have rescinded at the Department of Health and Human Services because protecting the conscience of individuals, so doctors, nurses, and such can't be coerced into having to perform these procedures.
Last week, detransitioners were honored, and you said that it was a priority for you to protect these detransitioners and help them get the care they need. What will that look like?
I think, first of all, recognizing what has gone on, recognizing the harm that they've been subjected to, and honoring them and saying that these individuals, for instance, at that conference had the courage, they have the courage to come forth and say, this is what we've been through. We want to speak boldly and openly so other minors, other children don't go through this. We have to honor that. So I was proud to be at the Detransitioner conference, standing side by side with them and letting them know that President Trump, Secretary Kennedy, and all of us at the Department of Health and Human Services stand with them, not against them, by trying to lead them down a path that leads to irreversible harm.
And a little more about the Religious Liberty Commission. Why do you believe this is so important in our current time to really shine a light on these types of issues?
Yeah, religion is foundational to the forming of our republic. It's there in our documents. It's there in the words spoken, the things written by our founding fathers and those men and women who founded this republic. So religious liberty is incredibly important. And again, this administration, us at the Department of Health and Human Services, we stand firm in our support for religious liberty.
What would you say to someone who is unsure or confused about how HHS and religious liberty could be connected?
I would say, look at what we're doing. Look at what we're saying. We're not just simply saying that we believe in religious liberty. We're not simply just saying that we're going to protect conscience. We're actually doing things. So we are keeping promises that the President and Secretary Kennedy have made.
HHS has done a lot on the transgender procedures for minors particularly. Is there more to come?
Absolutely. Number one, we're not going to back off of this. We're not going to stop talking about this very important subject, because the moment that we stop, then you can lose ground. The left will never stop. Those who support these sex-rejecting procedures are never going to stop trying to influence the kids and the parents in this, what I believe is a very harmful way. So we're not going to stop talking about it. We're not going to stop educating, and we're not going to stop standing up for these kids and their parents.
So medical students might be harder for them sometimes when they're training to, if they're religious, to stand up against some of these procedures in their training. What would you say to them about how they should handle situations that might arise like that if they're asked to do something they feel goes against their faith?
Stand strong. I would say absolutely. If your deeply held religious convictions say that you can't engage in some activity, for instance, abortion, for instance, or a sex-rejecting procedure, stand strong in that, refuse to do that, and again, reach out to the proper authorities and individuals at their institutions, but stand firm, stand strong.
What is your message for the rest of the Religious Liberty Commission today and in coming years? What do you hope to see come out of this?
I would say keep doing what you're doing. Keep having individuals on who work in the government, work in the Trump administration, who believe in this cause, believe in religious liberty. Let us inform you, let us talk to you, and keep going forward.
Awesome. Thank you so much. Really appreciate it.
Thank you so much. Have a blessed day.